Hey y'all, Sam Marion here, a licensed clinical social worker who identifies as multiply neurodivergent. I work in private practice with a lot of neurodivergent individuals. I currently work with autistic folks that range in age from about 5 up to early 60s. So I work with a wide range. I'm not the therapist who just works with kids, which I think most people often kind of think about that when we think about working with autistic folks. We think about working with kids, um, but there is this big trend and it's been going on for the last couple of years, of people um, becoming late identified autistic adults. Doesn't mean they became autistic. They recognized I'm in this category of being in my late 30s and recognizing, oh my goodness, I am autistic. And then reflecting back and realizing this makes so much more sense in so many moments of my life. And I get questions a lot. Uh, should I pursue a diagnosis? When I'm asked that, what people mean is, should I follow the traditional path of finding a psychologist, because that's who's typically going to do it, and do the testing to be diagnosed autistic? And so what I want to talk about today is more along the lines of, I'm not going to answer that question for you. I'm not going to give you clinical advice, but I do want to tell you a little bit about some of what I talk to people about when they bring that up with me in my office. So I always kind of ask people, what is your goal? What would you do with it if you had a formal diagnosis? Because honestly, when I talk about the late identified adults, and I use the word identified because I talk about autism and neurodivergence as an identity more often than a diagnosis, because then I'm embracing and owning it as part of me, um, in a much more positive manner, part of who I am. And so what do you want to do with that? Most of the adults that I work with are not formally diagnosed. They've not been through long assessment processes. I do work with some people who have been through that, but not as many. Most of the kids and adolescents that I work with have been formally diagnosed or are on a waiting list, and maybe have an appointment coming up in the next few months for that process. And it's a little more meaningful because most often, um, the family is going to take these results back to the school for supports and accommodations when they can get more clear on maybe some of the executive function challenges, maybe some of the communication differences that this person needs communication a little bit differently, maybe from a teacher, things like that. Maybe the teachers can better understand some of their needs, some of the sensory differences, things like that. But for an adult, what are you going to do with this? Um, Most people, when I ask that question, I kind of say, well, are you going to go back to your employer and ask for sports? No, I don't think I would do that. Most of the time it's because that's the mindset is, well, this isn't that what you do? You do follow this formal process. But I got to tell you, most of the time when I'm having these conversations with these adults, the amount of research that has been done already by this individual about autism is extensive. Not always, but most of the time. I have had people who have then chosen to go through the formal diagnostic process and then realized they may have known more about autism as a whole, especially current understanding of autism, than the person who did the assessment. That's not across the board. That's not everybody. But it is oftentimes, and if that's you, if you're going, wait, no, I know a lot about this, I feel very confident. This is where what you find is within the autism community, the late identified autistic adult community, hashtag actual autistic, within the autistic community, the neurodivergent community, for the most part, not everybody, but for the most part, identification, self-identification is accepted. Now, this is where I do get a little bit nerded out as a mental health professional, as a clinician, and I do distinguish the difference between identification versus diagnosis, because I view self-diagnosis, I struggle with that language some because I look at it as saying, well, a diagnosis or a diagnostic process is a specific process versus identification. I'm very comfortable with self-identification. I'm very comfortable working with people and adapting that language. If somebody comes in and they self-identify as autistic, I don't see any need for any pushback or question. Also, my clinical opinion has always been in support of their self-identification. This is not something where people, I think, are just claiming this identity to fit in. You'll see that pushback on social media sometimes that, oh, that's just following the trend. No, that doesn't really happen. And I'm sure, I guess I can acknowledge it may happen on occasion, but let's stop and think about that small percentage. Such a strong desire to find some group that a person can fit into, that they're going to self-identify with a disability. Let them have it. What's the need in pushback? Okay. I understand that much of the pushback against the late identified self-identified late autistic adults, kind of whatever language we use in this, comes from parents of autistic kids. They see, most often it is higher support needs kids, and it shows up a little bit higher support needs with adults as well, pushback, because it's viewed as a privilege to be able to be existing in the world where you self-identify and you don't need the same level of support. And that is a privilege, and we can acknowledge that. But also for many of these families, because I have worked with some of these families, to be honest, some of the communication and information that they are given about autism is outdated. It doesn't align with current understandings. It doesn't align with the current shift in direction that this whole field is going right now. As research is shifting, research is changing. And so the approaches that they were taught, some of these families were taught to take with their own kids, oftentimes doesn't align with these current understandings. And that's actually the tension that I see. The tension is in the understandings of autism and those differences of views, differences of understandings. And that's, I hope, something that we can also change over time. That's why I do some of the work that I do with professionals to help professionals change understandings. That's why I have another video where I talk about functioning labels, because so often psychologists will tell a family, hey, your child is this, and they would use a functioning label that is not clinical and it's not even in the report. And so often people's understandings, families' understandings, don't even align with what their own child's report says. And so then they take that and they get pushback against adults. And it's messy and it's difficult. At the core, we're talking about people that are really dealing with a lot of pain and really struggling. And we want to allow space for that. Okay. These are the conversations I have. Now, should you pursue it, I also encourage people to take a look, especially kind of where you live, the states you live in. What are the laws? What are the views legally that are in place right now in terms of, should you have a formal diagnosis on the record as an autistic individual? Does that potentially limit you in any way? Does that have any impacts on how the laws in your state view you as competent or not, or in your country, depending on where you live? Because sometimes the misunderstandings of autism in general do exist all the way up at those levels as well. And so be aware of that as you pursue it. And I would say weigh it all out. Do you need that affirmation? If you do, okay, go for it. But look at all the angles. Are you doing this because you think, well, that's what you're supposed to do, right? That's just a traditional approach. Well, I would say rethink a little bit. Take it into consideration. Self-identification is okay. Go on social media, TikTok, Instagram. You're probably there. If you're watching this video, you have probably already been researching and listening to creators, and your experience resonates with theirs, or their resonates with you. Allow yourself that space to know yourself. You can read online diagnostic criteria. There are quizzes, things like that. You can read about what the DSM says. But if everything you've learned as you go through this process aligns and resonates, okay, give yourself that space to know yourself and be okay with who you are. You got any thoughts, comments, questions? Let me know. Give me a like, follow, subscribe, check out other content that I have. I appreciate you taking the time to reflect over this today.